This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Welcome to another episode of the Impact Healthcare podcast. I love this random world of coincidences. So I met our guest today because one of my advisor buddies said, I have an amazing client that did some really cool things. We should have her on one of your webinars. And that's how we met. So Sepa, welcome to the Impact Healthcare podcast. How are you?
Fine, thanks. Thanks for having me on, Lester. I appreciate it.
Yes, ma'am. So, give us an introduction to you, to your great company, so the audience knows who's talking.
Okay. My name is Sepa Sete, and I am a native of Southern California, born and raised. Let's see what I do. I attended UCLA. After UCLA, I worked in the legal industry, in employment law. I'm not an attorney, but I worked as a non-attorney for years, and that was a lot of fun. And then I did what a lot of the lawyers there did and naturally transitioned to human resources. And so I've been in the game for almost 20 years. Um, and in 2012, I believe I moved from, I think it was food manufacturing, doing HR and food manufacturing to advertising. And it's been a ride. It has been a ride. So right now I'm with a company called Mocean. Mocean has been around for almost 40 years. They started as a trailer house. So if you saw, Marvel trailers back in the day, more than likely we made them. Marvel sort of, I believe Marvel put us on the map. I'm not sure. Don't quote me on that. But yeah, they've been around for a really long time, entertainment marketing. And then in the past 6 years, we've started to like venture into brands. And so it's been a good time.
Amazing, amazing. Seba, so in our conversation, I have learned something about you, and your heart is this big, and you care about helping people. I often find that people who do things for others, even when it might be harder for them, do it because they have some sort of why or some sort of burning desire. If I asked you what motivates you, what's your why? What would your answer be?
I think if you're going to spend most of your time at work, you should probably get something out of it that's more than just your paycheck.
Ooh,
And I think when I started my first HR role as an HR coordinator, I never fact checked the statistics, so don't hold me accountable to it. But what I heard in a training was that 75% of the things that people learned, they learned on the job after college. So post college, right? 75% of your learning allegedly took place in the work. And I immediately felt a sense of obligation that experience, that learning experience needed to, one, occur and be meaningful. It's a lot of time spent away from your home and maybe doing the things that you want to do personally. And I just felt like as an employer, we were obligated to give them a lot more. So
man, I love that. I love that, especially in an HR function, right, where the human capital of the organization is your responsibility. That's a good jumping off point. So, when I met you, I learned about the story and the journey you have taken to structure your benefits world today. Can you give me a cliff notes about what what was your aha moment and how you went about it?
yeah. So I think that most HR professionals, we probably have the same renewal experience. And that is once a year, your broker comes in and it's like, hey, so, they came back with a quote like at 20% or whatever, but I got them down to this. I think we can still get them down a little bit more and I'm working on it and blah, blah, blah. Right. And so every single HR person that I know that's involved with benefits negotiation has like said, yes, and me too. And then I was on LinkedIn scrolling through some things and I see this post about Ed Lagonde. And it was like, congratulations, broker of the year. And I remember Ed from an agency that I used to work at back in the day, and I contacted him because it had talked about the great things that he was doing. And at that time, we were just coming out of the pandemic. It was 2021, and we were, human resources was expected to know everything about mental health, everything about like, what do we do in a pandemic?
Dirty work, all of it.
How do we keep people engaged while they're working remotely, even though we've never done that before, right? So like
Right.
stuff. And I felt bad that we didn't know exactly what to do regarding people's mental health, but also their physical health. I mean, we're going through this for the first time as a people. And for whatever reason, that post caught me and I texted him. I texted him in LinkedIn and I just said, I'd love to have a conversation. I've been thinking a lot about our culture, what we can do for our employees. We spend the money on benefits and it's not a small amount, right? And how can we make it better? How can we tie it in with the employee experience? While we're trying to improve that, I'm pretty sure benefits is like pretty much tied into that experience. And that started it all. And then he responded back immediately and yeah, we've been in cahoots ever since.
Awesome, awesome. So, the if my memory serves me right, you guys took the employee life cycle and started to match that. Talk to me about that process.
So we mapped out the employee life cycle from, trying to attract candidates to the offer stage, to the hire, to onboarding and all of these things. And we just said, how do we plus it up? How do we plus it? What do we want to do here? What is the experience that we wanted them to have? And what I loved about that experience is that as Ed was like leading me through this, I don't think that I had ever thought about health benefits in that way, that like every touch point in the employee journey could somehow be enhanced with benefits, some sort of benefits. I just didn't know. It was like health benefits, what kind of plan, PPO, HMO, like that. And that was like the extent of the conversation. So
Right.
doing this was was pretty amazing. And then, even when you get to the point in your career where you're not close to retirement, but you're a senior manager and now you're responsible for taking care of your parents, right? Like what does that look like and how can we help them in that journey? And so the mapping of it was really important, especially when we got to, family planning. Um, well, but before family planning is like we're even looking at things at like 401k and savings. We realize like a lot of people who we hire are not yet interested in retirement. They will be. They're more concerned about tuition assistance. How do we, help pay down their student loans and things like that. So it was a meaningful series of conversation.
I love that. What was maybe your biggest aha moment? What was like the thing that you're like, oh my gosh, we're missing this big thing, or was there one clear thing that you're like, oh my gosh, we started there?
Yeah, I will say family planning that I mean, more women, more employees were asking about it. If we ever thought things were gonna change or they would go and then they would find out like, "Hey, I was talking to my gynecologist about, like, potentially freezing eggs or whatever, and it's not necessarily covered." And I didn't know anything about it, you know what I mean? And then we found out like, "Oh, $10,000 could be could go towards those services, but only if medically necessary." So I think we lost 2 candidates. I know one for sure told us, like, "These benefits in 2022, not acceptable." But that woke me up to I mean, women asking for it, and then also personally, I had my children later on in life, right? And I didn't know that it was such a struggle for a lot of women who were younger, women who were really stressed out, women who had issues, and, I grew up in a day and age where you didn't talk about your personal business at work, you know what I mean? Like,
Right.
any talk of culture, it was like, "Here's the exchange, you come to work, we give you a paycheck, and that's our" right? Like, I'm not trying to date myself, but, like, on the real, that is how it was, and so this kind of, like, threw me for a loop, and I started thinking again back to, the early 2000s when I started out in HR, just like, what is our obligation? What's our obligation to employees and how much are we invested in them? And so those conversations led us to, and that kind of thinking with our executive team, especially our CEO, who was very supportive, led us to um, get family planning and have an allowance of $25,000 lifetime allowance for any employee who wanted to go down that path. So,
So it's funny that you say that, struggling. I remember as a Latino boy, my mother put the fear of all things holy in me for getting a girl pregnant, right? Like, then, like, come to find out when I was, mid 30s into my 40s, now I'm mid 40s, and hearing how many people struggle with it, it's
Right.
actually not that easy to get pregnant. I would have thought growing up that if you looked at a girl the wrong way, you'd get her pregnant. So
That's a good mama. That's a
yeah, I agree. I agree. So there are some amazing stories about just this one vertical. Talk to me about those stories that came out of you matching life cycle, a benefit we didn't have. You're losing recruits. Talk to me about how that turned out.
So we've had some success stories. We've had I a handful of women who were very grateful and said that they were able to freeze their eggs, and that's great. There's a couple of them who are no longer with us. But but they were able to do it and it was meaningful when they worked for us, like they gave all that they could and it was a really good experience. I would say but our the most recent one, and I did get her permission to talk about this, was just that we had someone who sent us a thank you note when we announced the new benefit in 2023, I think it was. That's when we went self-funded and we were able to be flexible with the benefits. And she was one of the first people who sent us a note and just said, thank you so much. This means a lot to us. My husband and I have been having conversations, and I just want to say thank you. Hopefully, someday we'll be able to use this benefit. And then fast forward to last year, we get this email, the CEO, myself, and her boss saying, like, I'm expecting, in April of 20. So, like, actually a couple weeks. And so we are going to have our first Mocean baby. And we were talking this morning, and I told her about being on this podcast. And she was like, I just want you to know, like, this benefit is why we're having our child. Like, that we would have been able to, like, and when I was talking about it on the webinar, I told her, I said, I'm embarrassed, but I said, it just caught me off guard. I just started crying because, you just, for a lot of women, I'm not saying, all women, but for a lot of women, starting a family is very meaningful. I have a niece going through IVF right now, and I'm praying for her on the daily. And so to be able to be an employer and have a hand in that, to like make that available, like, duh.
Two quick stories. One, I literally have a friend who today's Thursday. On Tuesday, had a full hysterectomy and now can't have it. And so this was the encouragement I was having with her is like, look, yes, what you thought your path was going to be, but having had two parents that have passed, the impact that parents can make, yes, you would love it to be the blood, like, but you could still make an impact on people's lives. And knowing you had an impact on somebody who's going to impact another life, which is going to impact, like, that whole legacy thing is such amazing thought
Right.
process.
Right. Yeah, I agree. I agree. I hope your friend's okay.
She's, obviously, and again, I'm not a female, so I can only imagine, that whole, pressure of being a female and things of that nature. But but again, I go back to why I love and why our podcast is called Impact Healthcare. Like, to your point of like, hey, before it was just like health benefits and there's an HMO and there's a PPO, and you kind of think of that, like, we don't ever connect the true value of it. And I had parents that filed bankruptcy because of healthcare cost, and so, like, you don't know how that stuff shapes you until later on, so it's just such an amazing leader that you are, that you started that whole notion and that connection point.
Oh, thank you. So this year also, or last year rather, we had an employee who was diagnosed with a very rare form of cancer. And I will say, for that, in that instance, would traditional healthcare have covered it? Yes, she's on a PPO plan. It was. But in thinking about this experience, right, just like, going self-funded and being able to select a TPA and being able to select a network of providers and stuff, we selected a TPA who was aligned with my and Ed, our broker, was aligned with our goals in terms of, like, does this enhance the employee experience? And we were sold on them because what they sold us on was their NPS score. That's what it's called,
Mhm.
right? The
Yep,
NPS.
that promoter score, yep.
All of this employee and customer satisfaction. And I was like, okay, they get it. They get it. So back to the employee who has cancer, the rare form of cancer. She was, I think it was chemo treatments every week, 18 weeks in a row, right? And so it was, but I went to go visit her and she said, the first of all, the benefits. And I said, I know, I'm glad. Are they good? And she's like, Seba, they're not only good, but this TPA doesn't owe me a weekly phone call. Like I have not like my husband and I have gotten calls and she's like, and I'm thinking like, okay, well, they're gonna talk to us about some claims and because they're really on top of it. But she goes, but sometimes I just get random calls like, hey, how are you doing? Like, we know that you're halfway through it, or we know that you're a quarter of the way through it. Like, are you good? And that was mind blowing. I was like, for that reason alone, we're renewing with these people. I mean, just like, she's like, they don't have to. It's one thing that the insurance is great and that I don't have to think about it. My husband thinks about it. He makes sure that my premiums are paid, on a monthly basis. And that's fine. If we're out of network, which they were never out of network, which is crazy this time around, because the year before they were completely out of network, all of their providers. But that telling me that the TPA was calling just to make sure they're okay, like, "We're working on these claims that you submitted, blah, 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 everything's taken care of, but we just wanted to know how you were doing." I was like, "Thank you. Thank you for that." Like,
Man, it's so funny because we often talk about this, right? Like that that whole notion of change, right? You were doing this,
yeah.
you moved to this. I am scared of change, right? Nobody likes change. There's a new process. There's also a whole notion of you as an HR leader that like change means you have more work. And I'm assuming that you don't have, twiddling your thumbs looking for something to do every day, right? So you have that whole notion. But then to kind of end up in a spot that not only fiscally was responsible, but allowed you to enhance the benefits that you offer to the people who do everything in your organization. I mean, do you just look back and be like, it was hard, but man, like, good job, Sepa, good job, Ed. Like, I mean, talk to me about as you look back, like, how's that experience?
Yeah, I'm glad we made the move. It is a lot more work. A lot of it has to do with just catching up on the education. I mean, it's a completely different world, and I'm telling you, looking behind the scenes of insurance is just not fun. It's scary. I wanna close the curtain. There have been so many times where it's like, I just, fully funded. The company's just writing you a check. We don't ask any questions. I mean, I think the only thing that I asked was like, how many large cases do we have? And, I think for all of the years that we were on it, I think the most was maybe like 4 or 5 in 1 year, but the rest of the years were like 1 to 3, and still we would get these increases, right? When you're on self-funded, it's work. It's a lot of work, but it's meaningful work. I mean, because you have some control, right? There's cost containment programs that you can take advantage of. And so I feel like we're not only helping out the employee, but I'm also trying to make sure that the company is whole and financially we're doing the best thing for the company, right? And so it's just a lot of work because I knew nothing about self-funded prior to, having this conversation with Ed, but the employee satisfaction through the roof. And we have been able to save. We 2022, I think 2022, we were on a fully funded plan. 2023, we saved from what we spent in 2022. And 2024, I'm not done with the reconciliation yet, but it looks like we also saved from 2022. So it's like, yeah. So far, oh my gosh, knock on wood, it has been
Yeah.
worth it all the way around. Yes.
Well, and again, so it's funny, right? Uh, People always ask me, "Hey, you had a big job with a big firm. Why did you go this other direction?" And it's like, I felt
No, not.
I felt like a grim reaper, right? Like honestly, like you joked about it, but I when I get on stage, I talk a lot about like our business is like same old crap every year. You get a renewal. It came out at 20%. I got it down. Look how cool I am. And then, hey, you and I, as HR and the advisor, have to go in front of your employees and get them super excited to pay more money for a shittier plan. Like that's just not something I wanted to do over and over again. And so when you start learning that there's more out there, for me, I was like, anything that that produces a better outcome is
Yes.
always harder
Yeah.
than the thing that produces an easier outcome. And so, like, I'm a big fitness guy. I'm like, you can't get a six pack eating Twinkies. Well, you can't solve healthcare doing it the way that the person that you call premium, they call it revenue. Like, you just have opposite ends. And so I just appreciate when people like you take that on, kind of knowing and drawing that correlation that you could actually offer a better benefit while being very financially prudent.
Right. Right.
That's so cool.
Yeah. Yeah.
What's another area that you guys focused on? So we got family planning, we heard the cancer thing. Is there anything else that you're like, man, this was another thing that we did?
Well, I think, so it doesn't quite, it's a benefit, paid parental leave. Just try to figure out, like, how do we make paid parental leave happen? And it is a combination, right, of short-term disability, and state disability insurance, and then what we can supplement. So right now, for 8 weeks, we supplement the state disability, the short-term to our private, and then we get most people to 100% of their income. So it's been helpful. We've heard a lot of really great things about that as well. So, we have a lot of high paid people. And so
I was gonna say the talent for what you do has to be crazy hard.
yeah, yeah, it is. And so, but they're thankful that it's something, because prior to that, we had 1 week of pay and that was it. That was your entire leave benefit. So we've been able to help out monetarily. And then again, like, just being able to reach out to people and make sure that they're getting what they need. I can't say enough about the benefits. Since the pandemic, we have hired more people, not like a ton of people, but we've hired more people out of state. And so what we were able to do with the going self-funded is we swapped out our HMO for an EPO plan. And the EPO plan basically gives you access to the same PPO network as the other two plans, PPO, the traditional PPO, and the high deductible PPO, in any state. So prior to that, if you were out of state, you had to go with the PPO plan. You couldn't be on the HMO because the HMO was strictly Southern California. And now you can be in any state and go to, any doctor that you want to on the EPO plan. So that's been really helpful. That's something that we've been able to tackle as well. There are things on my mind that I'm kind of losing sleep over. I'm still trying to figure out the tuition, or the loan repayment plan. And so I know there are solutions out there. I just need to make time to prioritize that. And also, heavy on my mind, work in progress, is what do we do for those who are taking care of their parents, right? Like, at that age, they need leave. Sometimes FMLA is good, but how do we look at it in a way that is part of the, family planning? It's that full circle, right? You start a family, and now you're at the point where, you're having to help your elderly parents. So that's heavy on my mind right now, but we're still working through it. I hope to have a success story for you next year.
I want to hold you to that. What I love about this conversation, often people, and I'm going to say everybody, I don't care if it's the CEO on down to the average employee, don't recognize a couple of things. One, salaries and benefits are in the same bucket. Right? So, like, people don't understand, it's like, like, we're squeezing a balloon here, right? It's either I can pay you more, but if I pay you a little bit more, but our health insurance cost goes up 8%, you're just taking what I paid you more and offsetting it by the cost here. So did you really pay more, right? So that correlation. And then as an organization, I don't care what it is that you want to do. It requires money. You wanna put more money in your 401k, it costs money. You wanna do the parental leave, it costs money. So, like, when I think about your journey in this, I really think, like, maybe we didn't set off to save money. But now that we did, it affords us a significant amount of things. I can give more to people. I can be a better employer. And that circle of life on the employer recruitment side of this is like, if I can give a better benefit, if I could pay more, if I could give the parental leave, if my benefits package people are raving about, that allows me to sit as HR when I'm interviewing somebody and be like, hey, we have this, you have this, we have this. Look, this is what our people say about our benefits. Like, I just think that we often don't understand how everything is so intertwined and interconnected.
Right. Right. I think you're absolutely right. And if we could figure that out, right, like get educated on that, you can sell it better. I mean, I had a conversation with an HR person, a big advertising agency, renowned throughout the world, and she was talking about how they didn't necessarily need to lead, in compensation. And so she said, so there were a lot of people who might leave because they made a little bit more somewhere else. She's like, we're above mid-market, but we certainly don't lead, the market in compensation. But what we might lead in, and she says, we don't know for certain, is our benefits. And she says, and it is our investment in people. Like we don't just talk about burnout and then make work harder for you or like,
Right.
therapy or your gym pass thing. Like we really do. We have, biometrics are done on site, twice a year for people who, don't catch it the first time that it comes around. Therapy is on site. Like all of these things that they provide their people, right? And I thought about that and I thought, exactly what you said. It is part and parcel of the same. That is the total compensation package, right? Like we care about you as a human. So and we want to make sure that you're healthy all the way around. So, yeah.
What's interesting about that, it's such and I'm using this in the good term, a double-edged sword, right? It is, at the end of the day, caring more about people and helping them get healthier. It's a win because that employee knows that you care about them, and everybody wants to work for an organization that they feel cared for. A healthier employee spends less in health insurance claims. A healthier employee comes to work every day and is more productive. A healthier employee, da, 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 da. So it's funny. I remember when like Google and these big companies like that were doing like on-site clinics, and they would have you could bring your dog to work and all this stuff, and people would gloat about like that's such a cool benefit. They're such a cool employer. I was like, you do realize there's a financial benefit in there. Like, they would put a cot in your office if you'd sleep there and work longer. So, like,
Yes.
yeah, I like when just like, let's have a conversation and be open and honest. And I feel like a lot of employers kind of try to make these decisions in a vacuum and don't necessarily understand what their employees want, because you could have the best benefit, but if that's not what your people want, if you don't know who your target audience is, if you don't know the all of that, like there's no correlation there.
Yes. Yes. Yes.
It's
I
crazy.
agree. And I will say one of the things that we implemented addressing that, it was virtual health. So we know that telehealth care came with like PPO plans, right? Like that was part of the package, but you still paid, your copay because it was still a visit, right? And then we were introduced to a service called Galileo. And
Oh,
and so yes, and I use them. I if I'm not texting them on a weekly basis, I'm not doing something right. They're probably so tired of me. Um, but we introduced that because so many of our people were always busy. And even though, they're young, the thing that kept them the most busy was being at work, right? And so you're not making to your doctor's appointments. And so we introduced that and said, you can start your annual exams virtually if you want to. If you need to go in for a pap smear or something else, they'll make that appointment. They'll help you make that appointment. But you can start the conversation. They can send in an order for your labs. You can go to the Quest Diagnostics that's like 3 miles down from the office, right? You can get that all done just without leaving the office. I go into a private office and have this conversation. So that has been really helpful, super helpful. We've heard from people who live out of state or people who are vacationing. It's like my son got sick. I'm so grateful for Galileo. I texted, we did a video thing. They sent in the medication to the local CVS, and that's what it's about, right? It's that convenience. Our people are on the go. Our people travel. They live out of state. It's like we needed to respond to that.
well, and maybe your people make more money than the average, but when you start thinking about why don't people do the things that
Yeah.
they're supposed to do to stay healthy? The inconveniences of access to healthcare, whether it is true
Yeah.
inconvenience,
Right.
time, whatever, but some of the inconvenience is money. So when you think about that Galileo scenario, it's like I could do it in the palm of my hand sitting here at my desk. That convenience factor of LA traffic,
Right.
Like 3 to 5 minutes I'm gonna get with the doctor after spending an hour in the waiting room, like, I mean, it
After a month of waiting for an appointment.
or the appointment in the first place, right? The other thing that, that helps is the docs love it. Like,
Yeah,
docs get to do the thing that they went to med school for, which is to spend more time with the patient, not more time filling out insurance paperwork.
agreed. Yep.
If you
And
had
it's
to
free to our employees, I should say. It's free to our employees, and we paid less than $9 a month per employee. I mean, like, yeah, it's
Yeah, I mean, when you look at the ROI on that, you need to avoid, like, let's go ROI. ROI is my employees love it and it's a good benefit. Okay. Maybe a soft dollar ROI. Our dollar ROI, I had a rash on my arm. I had somebody look at it virtually. They told me it was just poison ivy and I would have gone to the emergency room, but all I did was go to CVS and get some Calamine.
I think,
Like,
yeah,
that's just $4,000, $6.
right,
Right? You just pay for 17 people's Galileo for the year.
right.
It's an easy thing. So I have a question for you. If our audience is advisors, our audience is employers, I want to take those on two sides. I'm going to start with the advisors. Um, Ed, I happen to know him. I'm very fond of him. He is somebody who um like, does all of the right things because it's the right thing to do, right? So I often find, if somebody came and had a client and they heard about this Galileo, they heard about this self-funding, they heard about this advocacy thing, and they heard all these new things, they're kind of scared to go to their client because it's like, well, I had them doing something else. You were fully insured before. I am now introducing self-funded. Why didn't I tell you before kind of deal. What's the advice as an HR professional who relies on their advisor to be a true partner about how to work with an employer of either introducing new ideas or asking them to do something that is more complex than the easy because it's the right thing to do? What kind of recommendation advice do you give to them?
I'm talking to the advisor, I'm talking
To
to
the,
another.
to the advisor, yeah.
I see. Um, I would start from culture. I would start from, this is what we're trying to do. This is where we currently are. We want to move in this direction. We want to attract this type of talent. This is the future that we see. I mean, we spend so much time talking about like business strategy and how do we achieve these goals, right? And I think that our benefits, like we've talked about here, should align with that.
So
So,
that advisor needs to get to know your culture, your business objectives, because I could recommend a wrench, but if you need a screwdriver because that's what you're trying to build, it doesn't matter that I have a wrench.
right, right. And then also be really direct about like, hey, so when renewal comes around this time, let's do something different. I just want to hear something different. I want to know what's out there. What are our options, whether they're self-funded or fully funded? Like just ask for that outright. Um,
Awesome.
and sometimes
Thank-
you'll get someone who's engaged, and sometimes you'll get someone who says right off the bat, you don't want to do self-funded. I was told for years, and not that I knew anything about it, I just had heard about it, right? I had heard for years that it was only for, your Fortune 100 companies, your Fortune 500. You guys are too small. Don't worry about self-funded. Like you guys could really pay a lot out of pocket. Nobody talked about stop loss insurance or anything with that. So for years, that stopped my curiosity.
Seba, how many employees do you guys have on the plan?
We have, on the plan.
Roughly. Roughly.
Yeah. So I would probably say like 125, 130.
Okay. It's interesting. I was just in California not too long ago speaking on a panel and I keynoted on something and they had some brokers on a panel and that exact conversation and one of the very, very large brokers were like, yeah, we don't start talking to our clients about this until they're 5, 6, 700 lives. And I'm thinking, oh my smallest client who's self-funded has 6 employees. Just 6.
Yeah.
And so I appreciate you saying that because, again, a lot of times, unfortunately, in that advisory role, it's a little bit self-fulfilling, right? If like nobody ever got fired for hiring Blue Cross. So if I can keep the status quo and just keep renewing, I might make more money. It might be a little easier. So I appreciate you saying like it's okay to tell me something different. It's okay to like encourage me to look at something different that you appreciate that from your partner.
Yes. Absolutely.
And then what about your HR peers that are listening and you went through a huge transformation? They're probably like, this lady didn't sleep for 2 years. She crazy. What would like do you look back and like, man, I wish I would have done this sooner?
Yes, I do. I wish I would have.
So if you could go back and do it all over again, like what would you tell like what's the advice from other HR people that are like, I want to be where she is, but how do I even start? Like how do I go to get there?
Well, you can talk to our broker, Ed Lagonde, with Nava Beth.
I'm gonna charge him for that lead right now on this. I'm gonna send him a text message. He's got a charge. He's got a charge on that. But outside of the broker, like you as an HR professional, navigating internal, navigating communication, all of
Right.
that jazz.
Yeah. Again, map out your employee life cycle. Figure out what your company, what's your culture? What do you want that experience to look like? And then see how you can enhance that with your benefits. And then find a broker who will, if your own broker isn't going to work through that with you, then find another broker. But I say start with culture. I say start with that mapping, figure out your life cycle. Yeah, it's important. It is.
Since it's my podcast, I'm allowed to say this. You're a badass. I love everything about your demeanor. Like it is such a real, conversation. A lot of times, again, you'll either get super HR that kind of is too woo woo and too warm and fuzzy and doesn't understand kind of the fiscal responsibility. And sometimes you get people, maybe a CFO that's, I would save money if I could, chop off, 50 of my employees and make my budget. I would do that. Like, I just love how you're such a blend of, those two things. So I just appreciate that about you.
Thank you. I appreciate you.
So let's leave the audience with one thing. So I always call it the one thing. If you had one piece of advice for anybody who's listening, because there's not a company out there that wouldn't say, I want to do more, and you're more advanced than most. But what's one piece of advice you would give to the audience?
One piece of advice I would say, mm, oh gosh, there's so much I want to say, but what's the one thing? I would do more than one. No, I would just say to really get to know your employees, like if you do an engagement survey, like do a comprehensive engagement survey. The listening part is critical, and I'm not great at it, and I say that as someone who could use a lot of improvement in the area of active listening. But when you can address their concerns, they I mean, the work experience for them is just so much better and it bleeds into other areas of their lives, right? But, again, it doesn't have to be cancer. It can be we were on vacation and my kid had an ear infection. Thankfully for Galileo, we just went in the middle of the night to CVS to pick up the prescription and you had a great vacation. Wonderful. That's a huge win. I would just say listen to what they're going through, what their needs are, and then if you can match it as an employer, try to.
I love it. Such a simple thing, but so profound. Sepa, thank you so much for spending some time with us. I think I've learned some things, and I'm literally trying to think of like the new branding of a consulting, process that's like first around employee culture. Because when you get into this side of the business as an advisor, like like I was taught about health insurance. I wasn't taught about employee culture
Yeah.
or the life cycle of employees. So it's like, we don't teach y'all as HR about the mechanics of how to control costs and all that. I think we would do a good job, like teaching us about like, hey, what are the other things that you guys are needing so that we could design this to make sure that this works. It's such a common sense, duh situation, but I'll tell you, 25 years in this business and it's not a common practice. So thank you for exposing that for everybody.
Absolutely.
Awesome. Sepa, thanks so much. And for everybody that's listening, if you are an advisor out there and you want to motivate other HR professionals to make change hit forward, hit share, hit like, and send this episode to everybody, because I think everybody could be inspired by Sepa and the leadership that she's done. So Sepa, thanks again. And to our audience, thank you so much for listening. We'll see you on another episode of Impact Healthcare.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.